All right, all right, all right. We made it to week 8 of Introduction to CPT and HCPCS coding. Wow. So, week 8 calls for us to focus on the HCPCS coding system. I hope that you have your HCPCS manual. So, just like usual, we have our objectives. We're going to look at key terms. We're going to refresh our memory on who publishes HCPCS codes. We talked about that in chapter 1. And then you're going to be able to select HCPCS codes. So notice I've been saying HCPCS. So it is pronounced HICPICS. These codes are alphanumeric. So they start with a letter, but they're only 5 characters long. There's no decimal point. So don't try to confuse these with ICD 10 CM. So as a reminder, you need the HCPCS Level II manual. HCPCS is published by CMS, the Centers for Medicare and Medicaid Services. And as you may recall, these codes were created because there were services that needed to be captured initially by Medicare and Medicaid that were not present in the CPT manual. And so we have things over here like walkers, wheelchairs, canes, medications, orthotics, ambulance services, just a whole bunch of stuff. All right, so with these services, a certificate of medical necessity is needed. It's also known as a CMN. This certificate, this certification, clearly explains why the physician feels that the patient needs this item or the service. The certificate should be filed in the patient's medical record for certain supplies, and although a CMN may be kept on file, this alone cannot justify the medical necessity. Documentation, documentation, documentation. Remember in the insurance class, we talked about documentation improvement. Another term that I know is not unfamiliar to you is the ABN, the Advanced Beneficiary Notice. This is a written notice to the patient that states they were made aware of the exact procedure being considered. Oh, pause. This is given to the patient before the service happens. So, the exact procedure being considered, the dollar amount associated with the procedure, and the possibility that Medicare would not pay for this service. So this is primarily a Medicare thing, but some other payers may have something similar. But typically, when you hear ABN, think Medicare. All right, so now let's dig into the sections of HCPCS. So first up, letter A, you're going to see transportation services, so like ambulance. You're also going to see medical and surgical supplies, and then other types of investigative or investigational services. With the ambulance, they're going to show you, the different types of ambulance. So advanced life support, basic life support, and then there are also modifiers that apply to these codes. Next up, the B codes. B codes are for enteral and parental therapy. This chapter is broken down into the formula and the supply. So, like if somebody needs to be fed by a tube, those are what is fed to the patient. All right, next up we have our C codes. This is for hospital outpatient prospective payment system. You know what PPS is. Um, these codes are for technical services only and may be reported by non OPPS hospitals, um, critical access hospitals, Indian hospitals. They got a whole list. Okay. Then we have the D codes, which are for dental services. Now, something to be made aware of. Some HCPCS manuals have the D codes in them and some do not. But there is a whole dental manual that you can purchase. E, durable medical equipment. So here, walkers, canes, crutches, respiratory equipment, pacemakers, just to name a few, are what's over in there. And of course, medical necessity, medical necessity, medical necessity. All right, G codes. These are temporary procedures or professional services. And these are services that have not been assigned a CPT code, but would typically be found in the CPT manual. These national codes are assigned by CMS on a temporary basis. So remember, these are primarily for services that are not in the CPT manual. H codes, alcohol and drug abuse treatment. Um, these codes are not recognized by Medicare, but are used by Medicaid agencies that are state mandated for reporting mental health services, including behavioral health. J codes. J codes are used to report drugs that would typically not be self administered. So, other stuff other than oral, right? J codes can be found by referencing terms like chemotherapy, inhalation, IV solution. Um, Most of the codes that you're going to see over there are going to be organized by generic name, but the brand name could be listed under the code description in some cases. All right, next up, we're going to go on over to the K codes. So, K codes are temporary codes assigned to DME, Medicare administrative contractors. You'll see things like wheelchairs and wheelchair accessories, as well as quality measures. But with the wheelchairs that you see over here, in the K, those are like the cheapy wheelchairs. No frills and thrills, right? They don't have the arms and legs that's moving around. They're not electronic and all the things. All right, letter L, orthotic and prosthetic procedures and devices. And here you're going to see orthopedic devices, halo procedures, scoliosis procedures. The use of orthotic treatment of scoliosis requires continual adjustments. And so it is important to know that. Whew, all right, this week 8. I know you guys are exhausted. M codes are for MIPS, valve pathways, medical services, and quality uh, measures. So you'll see things over here like cellular therapy, prolotherapy, IV chelation therapy, fabric wrapping of an aneurysm, and on to the letter P, pathology and laboratory. And I know you're thinking, wait, we had pathology and laboratory in CPT. So this code range is used to report chemistry and toxicology services, pathology screening tests, microbiology, and miscellaneous services. So, again, if the insurance company requires that you report these codes, you need to know where to get them from. Then we have Q, which are more temporary codes for supplies, drugs, and biologicals in the instance where there is no permanent code. So it could be, something new. R codes, radiology. I know you're thinking, wait a minute. So there are very few codes at this time over here, so don't get too excited. The R codes are used to report the transportation of EKG equipment and portable x ray equipment. S, temporary codes. These are non Medicare codes utilized by Blue Cross Blue Shield and the Health Insurance Association of America, also known as HIAA. These codes report supplies, drugs, and supplies when there are no national codes. So you see the theme here, right? It's like there are no other options available, so we go here. T codes are also temporary codes. These codes were established for state Medicaid agencies. So these codes are not recognized by Medicare, but some private payers do accept these codes. Codes found in this particular area are things like respite care, sign language, or interpretation services, nursing care in the home. You also will see, like for the FQHCs, the federally qualified healthcare centers, you'll see codes for what's called encounter rate billing. All right, U codes are used to report other codes not found in HCPCS. Currently, the U codes contain codes that relate to COVID-19 diagnostic panel and infectious agent detection. Vision and hearing codes. All right. So, vision services are first, followed by the services related to hearing, and then speech and language pathology. And wow, that was a lot, right? All right, then we have appendices. It should be noted that the appendices that they're discussing here could be in a different order in your manual. So just um, take that to no under advisement. All right, so Appendix 1 is the table of drugs. This is what we use to locate medications and drugs. We can look them up alphabetically, but also you want to pay attention to the route of administration as well as the unit. All right, appendix, did I skip appendix 2? Yep, I'm going too fast. Appendix 2, this is where you will see your HCPCS modifier, much longer list than what you saw in CPT. Modifiers could be alpha or alphanumeric, so all letters or a letter and a number. All right, after that, we have Appendix 3. Here you have some abbreviations and acronyms that are used in HCPCS. 4 identifies a listing of CMS web-based manuals. 5, new, changed, deleted, and reinstated HCPCS codes. Yes, that sometimes they bring them back. Appendix 6, a quick reference of place of services and type of services. And as you know, that's needed for claims. And we are at the end. You made it to the end of your introduction to CPT and HCPCS coding. I know you are excited about um, intermediate coding, where there's not really a textbook, where you're going to just be coding from reports. All right. See ya.